after your shoulder surgery. So it is important to protect the repair for 6 weeks after surgery. You'll be using the sling full time until then, with the piece going around your back when you're sleeping and walking around. If you're at home typing on a computer, eating, waist level activities, these are safe. You do not want to actively bring your arm out or up or behind you. At 2 weeks, I will see you post-op and we will start physical therapy at that time. If I feel that it should wait till 4 weeks, I will let you know as well. When you come home, though, you're going to see the sling. Under the sling is going to be the cold pad, and under the cold pad will be your dressing. You will, after a day or two, if you're ready to take a shower, you're going to take off the sling. So imagine there's a band coming around here. We're going to take that off, and let's grab that from you. Take the sling off. The sling that you may have may be more sturdy depending on which facility we've gone to. You're going to take off the cold pad. The cold pad I want you to use all night long when you're sleeping and anytime you're not walking around. It really helps bring down the swelling, bruising, as well as the pain. Most of our patients actually don't need narcotics after surgery, even with rotator cuff and labral repairs, because we control the swelling. Controlling the swelling is very important. If the pad does not feel cold, call the company up and they will check it and either replace it or tell you how to fix it. There's a white barrier between the pad and the skin. You don't want the pad directly on the skin. This is already placed for you. The pad is connected to this cold unit. You will have to change the ice once or twice a day, so you'll need to get bags of ice or have an ice maker. It shows you inside how far to put the ice and then the water. Once that's connected, you plug it in, push those in, and it snaps together. It will then run as long as you have it plugged in and it gets cold. When you don't want to use it, you simply unsnap it. A day after surgery, you're able to take a shower. You will take the sling off. You'll take the cold pad off. It has 3 Velcro straps. They're numbered, so they're easy to replace. And you simply take this off. If you had a rotator cuff or labral repair, you're going to keep the arm at your side. You're not going to lift it up. When you're in the shower, you're going to lean forward to get to your armpit, and then you bring it back. To dry it, you lean forward and come back. There's a waterproof dressing on here. This can stay on until you see me. If it gets itchy or there's a rash, you can take it off sooner. Or if it somehow becomes loose and water can get in, you can take it off sooner. If you have questions, just call me. I will usually remove this in the office. Underneath this, you're going to see little yellow things and white strips in case this comes off before you see me. I will be removing the yellow strips. And attached to the skin, you'll see these little white strips. The white strips are actually your stitches. You do not want to remove those before seeing me, especially if it's within the first week. After the first week, the wounds are probably healed enough to remove them, but it's better to leave them on till you see me. In the office, I will be removing these and changing them. Because we're keeping the swelling down and using the ice machine, most of our patients are able to control pain without narcotics. We've told you to get Tylenol extra strength and Aleve. You're going to take 2 extra strength Tylenol when you first wake up, lunch, and go to sleep. You're going to take 2 Aleve with breakfast and 2 Aleve with dinner, even if they're close to the times that you wake up or go to sleep. So again, you're going to take 2 extra strength Tylenol as soon as you wake up, 2 Aleve with breakfast, 2 extra strength Tylenol with lunch, 2 Aleve with dinner, 2 extra strength Tylenol when you go to sleep. If you have severe pain the first day or two, substitute Vicodin for extra strength Tylenol. There's Tylenol and Vicodin, so you don't want to take too much together or you may hurt your liver. If for some reason you have medical reasons that you can't take these medications, make sure you talk to us about it beforehand so we can alter this plan. You will have anywhere from 2 to 4 or 5 incisions. Usually there's 2 to 3. If I did a rotator cuff repair or a subacromial decompression, there's usually going to be 1 on the side. If we did an anterior labral repair, there's going to be 2 in the front. There's always 1 in the back. Because we've done a subacromial decompression, a Mumford distal clavicle excision, or just cleaned up tears within the shoulder joint, there is nothing to worry about as far as ruining the repair. So you will be allowed to move the arm as tolerated starting day 1. Most people get rid of the sling around the 5th or 6th day, but you can still use it to walk around town if you feel more comfortable. Many people use the sling at night for sleeping because it's more comfortable. Usually the hardest thing is trying to get to a position that you like during sleep.